Okay, first up, we're shining a light on what we hope is going to be a game-changing initiative. It's set, hopefully, to revolutionize healthcare for all of our senior citizens. Our nani, nana, dadi, dada, if you're watching, this is for you. The central government is rolling out a brand new health scheme just for those who are aged 70 and above. And it's coming our way within this week. This is the centre's flagship scheme. It's called the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. And it's an exciting new initiative that will offer a whopping 5 lakh rupees of free healthcare insurance. This is over and above what already exists, making sure, hopefully, that elders get the care that they deserve without any hassle. Now, we're going to walk you through everything that's been said about it. So we've taken a look at what the policy says it'll cover, and we're just going to first share that information with you. First up, the government says application will be a breeze. Seniors can apply through an easy online process. There's face authentication. It'll make things quick and simple. There'll hopefully be no waiting around, no bureaucratic red tape. Once the eKYC is done, your card is good to go. And again, hopefully, the cherry on top is being said to be that the scheme is set to benefit around 6 crore senior citizens. It's especially good news for women because they obviously make up 58% of this age group. And with over 50% being widows, it's hoped that this coverage is a significant step towards providing better healthcare. But as we told you earlier, we want to dive into a little bit of what it's actually going to cover. Ladies and gentlemen, get your pen and paper out because we want you to know these details properly. Number one, what is it going to cover? Medical examination, treatments and consultations of all kinds. Essentially, all essential medical consultation will be covered. Pre-hospitalization expenses, so the costs that are incurred up to 3 days before hospitalization, that will also be included. You'll have medicine, medical consumables, all required medicines, medical supplies, all of that is covered. Non-intensive and intensive care services. So both types of care are fully covered. You have diagnostic, laboratory investigations, any kind of necessary tests, diagnostic procedures. Ladies and gentlemen, if you have parents or grandparents who will be needing this, please pay attention. Any kind of medical implantation services, that will be covered entirely. And now these next two, accommodation benefits. So stay is taken care of if you're getting any kind of treatment. Food services, that's often something small but very important. And any kind of complications that are arising during treatment, any issues that arise, all of that is also covered. Post-hospitalization follow-up care, up to 15 days, all of that is covered. So our senior citizens will hopefully have access to quality medical care, including hospitalization, surgery, diagnostic tests, without worrying about the expenses. This will not only improve, hopefully, their health outcomes, we're hopefully looking at just a much happier older generation. Okay, we've got with us a guest on the show today. This is a very senior doctor, Dr. D.S Rana. He's with us. He's the head of nephrology, but he's also the chairman of the Gangaram Trust. He's joining us on the show today. Good morning, sir. Thank you for joining us here. Doctor, we're actually going to come over to you to just break down for our audiences everything we've just discussed. So what it's going to mean. We also want to ask you a little bit, doctor, about your own experiences. So where you see people hesitate, people of that age group, we want to just clarify a lot of that with you. Okay, doctor, our first question to you about this entire scheme. We've talked, doctor, a little bit right now about everything that the scheme is covering. And on the face of it, it sounds awesome. Doctor, I just want to ask you, what is the scheme going to cover in terms of people? And I just ask you that because if a family has 2 older people, does that 5 lakh rupees get divided? What clarity do we have there?
This is not clear right now whether the same amount will be divided amongst more than one senior or not. But this requires clarification. Right now, this issue requires little clarification.
Okay. Doctor, can you tell our audiences, so that's a point that it is important to pay attention to. Doctor, just tell our audiences, seniors, when they're coming in for this kind of treatment, this care, we just read out to our audiences what will come with it. It sounds like it's covering a whole lot. What does it not cover? What should our audiences be aware of that it doesn't cover? Because it sounds really like it's checking off every box right now.
I think, but these it covers very important thing that most of time what happens that after 70 people get into problem of say heart, you require sometimes stents and the valves and some orthopedic problem like joint replacement, then cancer treatment, very expensive drugs. So if those are covered, then this is and they are being covered, Firstly, I would like to say heartiest congratulations to the Prime Minister of country and government for taking this initiative, which is first step after 75 years that at least under health for all or we are taking care of now. We are starting from a senior citizen, and irrespective of their income and caste, creed, everything, everybody is covered,
Right.
So the only issue which is we are not knowing right now that if there are more than one senior in the family, then whether they will be this amount will be divided or each senior will be getting. I feel that if I just imply from the previous scheme, then even when 5 lakhs coverage was there, that was the total family. So as far as my interpretation goes, I think this amount will be divided among us seniors,
Okay.
and hopefully we don't expect that every senior will become sick.
Doctor, I just want to ask you, in our own research for this story, something we heard when we were talking to the seniors in our own lives was that sometimes, and this they were telling us before we were talking about this scheme has just come in. But they were saying in the past, one of the difficulties they do have is with a lot of the paperwork that is associated with such schemes. It's all very complicated. I want to ask you, doctor, because you administer a hospital, is this something that hospitals look to fix by having attendants who can particularly help the seniors?
I think this is not a very big issue. In the family, there are a lot of young educated people today. Everything is almost online, and every empaneled hospital they have got help to people. So I think this is not issue at all. People will not face any problem. They should be really very happy that they are getting this advantage. And otherwise, in our country, most of people are not covered by insurance, by private insurance. So they get very difficult to get treatment, especially when their kids are away or they are not very reluctant to get treatment for old people. This is very, very big step, actually. Very, very, I think, significant step and very good initiative. So I don't think there is a problem anyway.
Okay, doctor, just bring us a bit of an overview here because we want to ask you, as someone who sees patients come in, just tell our audience, is this demographic 70 plus? What is the most common set of issues they come in with? Just so we can understand what the issues are.
Yeah, I told you that all non-communicable disease, but even communicable disease will be there. But especially non-communicable disease, let us say, where implants are involved. Like let us say somebody gets into heart problem, requiring stents. So they could not afford this. Now they will be able to afford this treatment. Similarly, very expensive cancer drugs. Similarly, let us say joint problem, joint replacement, implants for joint replacements. So wherever some cost is involved, this will be covered by the scheme. And you were just talking that let us say if the scheme gets exhausted in any case,
Yeah.
then in any case they are eligible for free treatment in government hospital otherwise also. So that problem that they will be this is a very big help. Obviously, some treatment will be very, very expensive that may be beyond 5 lakhs or 10 lakhs. So that problem of course will be there. But major cost of implants and drugs will be covered within this amount. So that is the most hindrance is implants and expensive drugs. So once they are covered, then rest of the thing they're not necessarily they need to go to some private hospital, independent hospital. They can always go to government hospital. We have got a lot of government hospital and they're in any way consultation, room rents, etc. They're always free actually. So there's not much to worry about. And if wherever it is implied to the people upper middle class or higher class, they are in any case having their own insurance also. So
Right,
then later,
doctor, we just wanted to ask you that question next because you can tell us the data, you have access to it. What percentage of the patients that come in, doctor, actually use government insurance schemes like this? What do you see?
I think this scheme, it is all eligible families, they are utilizing this scheme, and more and more people are inclined to use this scheme in whatever states it is there. Anyway, Ayushman Bharat it will be in almost every state. And I'm very sure that every citizen will like to enjoy this scheme now. Even if the people, those who are having, let us say, those who belong to little upper class and having those who can afford, probably they may also enjoy this scheme in the beginning and later on switch on to their private insurance, because that is provided in the law. It is only that people, those who are having their own insurance, there is no dividing of using this scheme. So I think there will be very big utilization of this scheme.
Okay, awesome. And doctor, one
Yeah,
last...
only thing that
No, go
every
ahead.
hospital is not empaneled for that, and especially bigger private hospital, corporate hospital, they do not adopt this scheme. So those people in any way can afford, those who go to corporate hospitals.
Yeah.
In any case, they are having, they are either they rich, they can afford from their own pocket, or they are having heavy insurances also.
Okay.
Our middle class family, which is, says, I must say, about 80% population, they are those who are not having their own private insurances, and they are almost impossible for them to afford this sort of care
Right.
without selling their property. They will be able to save their homes now. They will be able to save their properties.
Okay, so the number you gave us, doctor, you said 80% of especially middle class homes you see, they actually
They
do
don't have
use.
insurance, especially older people, because insurance premium is very high.
Right.
So until as people have got it, maybe after 10 years, 20 years, people will be having, as the things stand today, middle class family, they do not have any insurance for older people. It's become very difficult.
Okay, doctor, so
Very,
you've
very
had
minuscule is having insurance.
You've had very, very positive words to say about this scheme, and we felt the same way. We thought this was such an excellent initiative. We want to ask you one thing, Doctor. The government does plan some more expansions. And so I just want to ask you, in terms of expansions, what do you think more needs to be added on? The government is already saying that they are going to improve
No, no,
aspects of it.
this they have allowed to everybody in respect. So the government has already allocated money for that. So I don't think they will have problem. They know if, what percentage they have got data actually, and adequate funds have been allocated for that. But
Okay.
the biggest problem for the hospital comes and they do not get reimbursed. So that is so I think teaching problem of even PMJ scheme is they're all over actually, and more and more hospital adopting to adopt them now.
Right. Okay. Dr. Rana, thank you so much for joining us this morning. Thank you for taking out the time. We hope our audiences feel like you got a little bit more in terms of perspective on this story. Okay, we're going to take you now very